why is US healthcare the way it is? And using the lens of an accountant, I very quickly realized that the incentives are just set up for it to be this way.
Welcome, listeners. Today I am without Jolene, and I will be for the next few episodes. She welcomed baby Ben into the world in August, but I do have a very special guest with me today. I'm happy to welcome Nathan to the podcast. Nathan is first and foremost a husband and father of two. He lives in Colorado and spent 8 years in the Navy. Nathan has experience in accounting, data analytics, and business development, and today he comes to us from Peak Med Direct Primary Care. Nathan, welcome to the podcast.
Hey, my pleasure. Thanks for inviting me.
Thank you for joining me. So before every episode, we talk to our guests about what they can share as kind of an industry insider about how they navigate the healthcare system so we can help everyday users to be better consumers. So first, I want to set the stage. I think healthcare benefits are evolving and changing constantly, and sometimes it feels to me like the end user really has no idea what's going on. They don't see the stuff that we see all the time. They're just kind of the end user. It's not the thing that they need to know in detail. So all you want to do is go to the doctor and understand how much it will cost. But first you have to understand who you can see or who's in network. And people, I think, are familiar with looking at their ID card and they look for one logo and they say, that's where I go. But that's not always the case anymore. So I feel like you have a really unique perspective on the PCP experience and changing plans. So I want you to talk to us about that.
For sure. Yeah. So, thanks for the intro and the bio. I did start off my career in the military. And when you're in the military, you're very insulated from the everyday experience. And one of those is healthcare. So I got out very ignorant when it came to healthcare. So I was about 28 when I had my first experience. And that's when I started my family. First job as an accountant. No longer having the dream or aspiration of being a professional golfer. I went to the exciting world of accounting. And that was my first experience with employer-sponsored healthcare. And I was pretty shocked with the premiums, how expensive they were, spending $1,000 or more a month, how little access and care and quality you actually got. And, I was like the ideal plan member. I'm healthy, knock on wood. Same with the family. Pay our premiums every month, but we don't really utilize the plan.
Yeah.
But you know how it goes. You're healthy until you're not. You don't need to utilize the plan until you do.
Yep.
And my experience with that in 2017 was when I needed to use it, I didn't have anywhere to go. So I did, to your point, you have this little card and you can call, but you don't have a primary care you can call. So you end up going to the ER urgent care. And then you pay a ton of money out of pocket with your copays, and then everything's deductibles. I chose the high deductible health plan, not because of an HSA, but because it was just the lowest premium.
Right.
So everything was out of pocket. So at the end of the year, I spent over $10,000 and I really had no value out of it. So that was my starting point into healthcare, of trying to do a deep dive of why is US healthcare the way it is? And using the lens of an accountant, I very quickly realized that the incentives are just set up for it to be this way. So have a relationship with a primary care doctor and just know that there's ways to develop that relationship that doesn't involve that card. So that's what I would say is there's always lower cost alternatives. Just because you're paying X dollars for that health insurance doesn't mean it's going to be the lowest cost or the highest quality.
I think that's an excellent point. And I think one of the things that, as Jolene and I have been talking to more and more people, that relationship with the primary care doctor comes back to that, the quarterback of your care type scenario. They're the one you want to build the relationship with to help you make some of these decisions and to help you pick the right specialists or places to go. That relationship and getting that annual physical done and sort of getting your baseline for things so that when you're well, you know what a state of wellness looks like for you. Exactly. And it's easier to help identify when you are not well.
That's a great way of putting it. And that is the relationship you need with a primary care physician. They need to know you when you're well so they can help identify when you're not well and what care is appropriate. And that's probably another thing I'm seeing more often is because there's no access to primary care physicians in the traditional sense, there is in the direct primary care sense. And people are waking up to that. I'm seeing more employees use specialists as their primary care. And what I would tell them is, one, you're paying a lot of money and your employer's paying a lot of money to manage something that a primary care physician could handle. And just know, even though your doctor, your specialist is a good person and very competent, they're trained to see problems and they're paid to do usually invasive procedures. So having a primary care physician, one, they can manage your condition much more effectively than the specialist because they have the access and the training to do so. But they can also help navigate to less invasive, lower cost alternatives than slicing and dicing. So, yeah.
Yeah, slicing always seems like plan B, if it can be.
Yes.
So tell me a little bit about when you and I talked, you had initially that ordinary plan, right, where you pay the sort of fixed rate per month, whether you use it or you don't use it. I know when I had my daughter, I actually paid $0. It was 2004. My out of pocket for that, my daughter cost me nothing. My son was a whole different story 4 years later. Totally different. That was, everything had a copay, and then there was a certain amount that you paid for maternity, and totally different experiences in a span of 4 years. But both commercial plans with a traditional ID card and a traditional network setup, but entirely different cost experiences for the same, if anything, her birth and delivery was a little more problematic, and that was the cheaper one.
It's so interesting. Yes.
It's really crazy.
Yeah. And that's a perfect example of the care didn't change. The cost of care did not change. It was the shifting of how you handled cost, who absorbed the cost, and what insurance covered. So at Peak Med, or any direct primary care for the most part, since we're not fee for service, we can and we don't make margin on the transaction level. It's all via recurring revenue in our subscription. We can just shine a light on how inexpensive generic drugs, labs, and services are. So I'll give you an example on services. So if you cut your hand and you go to the ER urgent care, you're going to get a bill, or your employer's going to get a bill of $250 to $5,000. It's going to vary that much depending where you go. You go to Peak Med or a direct primary care facility, because you can get in the same day, they can stitch you up and it's going to cost you $0. The reason it's going to cost you $0 is because the material cost of a stitch kit is $8. The labor cost is 15 minutes. And we just don't assume that you're going to cut your hand every month. And it's part of your membership. It's part of your scope of services. The reason your urgent cares and hospitals charge $250 to $5,000 has no relation to the unit cost of the procedure. It's because they have high overhead, and their revenue model is designed to maximize the margin on every line item. So this is how you can start saving a lot of money, by showcasing how inexpensive care actually is. And direct primary care allows you to do that because it's outside the world of insurance. It's outside the world of fee for service. So it flips everything on its head.
That hits me hard because I feel like I've seen a hospital bill for Band-Aids where I was like, were they woven with gold?
Right?
Band-Aids seem very expensive.
The fairy dust on there to make me better?
Yes. It has magic in there. So one of the things that I think happens in the, when you're on the back end of the medical services, the healthcare services industry, or we're looking at like insurance or insurance type services, when you look at an ID card, I feel like it's like the keys to the kingdom now, because I did not realize, like I ignored most of it. I just would hand it over like a credit card when I would go to the doctor and
credit card, yeah.
Right? Pay attention to it. But now I think there's narrow networks. So, within one hospital or healthcare system, there are direct primary care, there's national networks, regional networks, and all of those play out and the experience very differently. So if you go from one employer that has, a national network where you have certain access to physicians, and then you move to a new employer, or your current employer moves to a DPC model or a different network, it's almost like a re-education on who can I go see and how does that work. But
Right.
on the employee end, I don't know that they're looking at like, oh, we have moved from a national network solution to a DPC solution.
Right.
So how would you know if your employer selected a direct primary care arrangement, how would you know that as an employee?
Yeah, so I do a lot of open enrollments, and what I try to tell employees is conceptually with direct primary care, all we're doing is taking healthcare back to the 1970s. So back then, if you needed care for you or your loved one, you just called your doctor directly. There was no barriers to access. They'd pick up the phone, they'd know you by a first name basis, they would see you that day or the next day, and there wouldn't be a crazy third party bill. So that's at the conceptual level what we're doing. So health insurance is not healthcare. That relationship with your direct primary care provider, your primary care physician, that's the healthcare component. So to put health insurance in its place, go see your DPC doc early and often. Doesn't cost you anything. If you need to tap into your health insurance, your company credit card, your direct primary care physician will let you know it's time to tap into your health insurance. Let me guide you to the appropriate level of care. So that's what I would say to an employee. You still have health insurance. DPC is not replacing your health insurance. It's just allowing you to have a relationship with the doctor, so there's no cost barriers, and then there's no barriers to access. And if you have a primary care that existing, by all means, keep seeing them. Just know that when you cut your hand or you need to go to the ER urgent care, call your direct primary care physician first, because they can likely get you in and it's a $0 cost to you. And then once they go to a DPC doc, they usually don't go back to their fee-for-service doc. So it's a carrot approach of getting employees steered to DPC. So that's how I would explain it to an employee. Not replacing anything.
Just supplemental.
It's just expanding care.
So you use direct primary care for your family?
Yep. And it's the totally different experience. So Cameron, he's 4 now, be 5 in December. When he was born, his first year of life, we went to the ER urgent care a couple times. Part of that could have been first-time parents, but really just didn't have any access to care, even though I had paying a ton in health insurance. Fast forward 4 years later, I know enough about healthcare to be a little bit dangerous, and I have direct primary care, and I'm working in the direct primary care space. So I'll kind of give you a quick story of comparing and contrasting Cameron's experience and then Adelina's experience, who's now just turned 1. So when Adelina was born, about a month into her being born, we noticed that she had a protrusion in her stomach, and it kind of freaked my wife and I out. But instead of rushing to the ER urgent care, I just took a photo, texted my DPC doc, circled it and said, "Hey, what the heck is this? Should I go to the ER?" She replied back in like 5 minutes and said, "It does not look like an emergency. Rest easy tonight, but bring her in first thing in the morning. We'll put hands on." So I avoided an ER visit that night. The next morning I showed up. Our doc spent about 45 minutes putting hands on our daughter, making sure she was okay, reassured her she was okay. But what she also did is she took that photo, which when you text your DPC doc or call or email, it goes to your medical record. So she took that photo and forwarded it to 3 different specialists who are paid to do consultation with primary care physicians as if I was in the room with them. And it's no cost to me or the employer. It's just an added benefit for DPC. Most DPCs have it. All 3 of them confirmed. It was like a pediatric surgeon, a general surgeon, and somebody else. All 3 of them confirmed that it was not umbilical hernia. Do not need to see a specialist. Surgery is not required. The appropriate level of care is primary care. And here's some things that you can do to alleviate pain. So all that within a 48-hour period. Avoided ER. Avoided a specialist. Since I avoided a specialist, I avoided unnecessary surgery. And I was giving reassurance that she's okay and here's some things I can do. Now she's better and she's a year. It's just crazy. Like if you remove the barriers of access and cost to physicians and you incentivize the physicians through the way they get paid to allow them to practice at the top of their license, there's a lot of things that they can take care of and mitigate those downstream costs. So that's like a real world experience where if you can now extrapolate that to an entire planned population, you're providing a meaningful healthcare benefit, which should be your primary goal for providing a health benefit. And then two, you're minimizing so many downstream costs, and you're going to see that in the plan. And then when you work with partners like Nova that can actually, ingest that data, that can actually validate the savings through the clinical activity that's within the DPC walls.
Well, it's savings. So, it ends up being savings for the overall health plan, but also the user, the end user. It's a difference in your wallet because those were dollars you didn't have to spend, even in that paranoid new parent phase when everything is feels like an emergency. Maybe that's me.
No, yeah, that is so true. And the first year of Adelina's life, never seen an ER urgent care. So that's a big difference.
Good for you.
Yeah. Well, second time.
I want to say that's great parenting, but maybe it was your good PCP relationship saved you.
It was both. Yeah. But.
Well, that's excellent. I feel like there is more and more and more direct primary care access. So I think as a solution for employers to provide it as a part of their benefits, if it's not something people are familiar with yet, it's something that they're likely to hear about moving forward because it just feels like something that's growing.
It really is. The trends are almost exponential at this point. Hint put on a summit a couple months ago in Denver, and they showed the trends of employer adoption, and it's massive. And 2020, 2021 really validated this business model because when everybody was reducing care, hospital systems, insurance carriers, when they were reducing care, direct primary care actually expanded it. And that's because we have no ties to hospital systems and we're not burdened by insurance. There's no barriers to access. And telemedicine and virtual primary care is just a standard offering of direct primary care. So when employees' behavior shifted to virtual, direct primary cares could accommodate
ready to go.
So we actually expanded care with our employer groups, and that really validated the movement. And it's only going to get bigger, and it's getting to the point now when you do open enrollments or you go to employers that currently don't have DPC, you just ask who's heard of direct primary care or Peak Med if it's in Colorado, and there's usually one or two that raise their hand, and then I can just say, hey, just go to them and ask what this is and how it works. I don't even need to say anything. But it helps with employers to adopt it because now you have employees saying, hey, I like this benefit. Yeah. I want it. And it's much easier for advisors and TPAs now to kind of offer this as a standard, healthcare solution within a plan. So.
Well, thank you very much for joining us. It's always so interesting to get different perspectives and see how different people kind of in the industry are using their plans and maybe using them differently, because I think there's so much confusion. Like you said, your first experience using it is it's expensive, and are you getting what you need? What are you getting for what you're putting in? And to, as a consumer, to understand that better, and then to choose the right plan for you, to choose a PCP, to work with a PCP that you can actually build a relationship with. It feels like gold.
Right. And, the trends are clear. Physicians want this model. Employees want this model, and advisors and TPAs are getting more sophisticated to where they can actually offer this as a real solution. So it's an exciting time. So thank you for inviting me. Appreciate it.
Well, thank you very much. This podcast is brought to you by Nova Healthcare Administrators. Why did they let us do this? Because at the end of every day, every Nova associate is driven to do what is right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people who we convince to share their tips with you. Don't forget to leave a review, give us a like or subscribe, but more importantly, please share. We'll find the insiders if you share it with the outsiders. You can find our podcast on Apple Podcasts, Spotify, and pretty much wherever you're finding podcasts. And we hang out on Twitter too at UNDR The Coverage.